Hi, I'm Eileen. My company is Bega. Bega gives advice. I'm an occupational therapist, and this is round 3 for OT pet peeves. And I guess I'll just launch. All right, the busy work to get your documentation done. I've literally had a manager tell me to put somebody at the table, give them busy work, and yes, they use that exact word so that I could get my paperwork done. Well, getting my paperwork done is not what makes my patient progress. And as related to my other video about the problem with productivity, is that that's not a skillable thing, and even more important, it doesn't help them. They don't need to sit and watch me on a computer. They need me to get hands-on in their face and make them do things. So this is where I say this whole concept of point of service, which is getting your documentation done while you're sitting with the patient, and the only reason for it at all is to make it billable. Every now and again it's good because you can review the goals and type, but the only point of doing that is to make money for the company. So I feel that it's a wrong thing to use their paid therapy time just to type. Okay, so that's, and I don't blame anybody. Let me just say that yesterday I literally saw somebody doing point of service documentation, typing on their computer while their patient was sitting right here sleeping in the wheelchair. And I don't blame them, because that's what the pressure is, and if you don't do that, then you're going to get in trouble. So, but that's a pet peeve, just seeing that. It's not good. Okay. Another pet peeve is, and I think this is, well, I'll line them up later, doing very impractical things. I saw one time a therapist, and I'm not, again, this is no slur on any individual person. They're doing the best they can under a lot of pressure. Okay, dressing the lower half of the body. I had a patient one time, and he was on bed rest because he broke his hip. He had severe dementia or delirium at the time, and he did not even realize that he was in the bed in the nursing home. So the therapist's goal was to have him dress his lower half of his body in the bed with using tools, a reacher, and all that kind of stuff. Okay, now I admire the ambition of this, but what's the practicality of that? The guy is in the bed. Who's going to hand him his pants? Who's going to teach him the tool, what the tools are for? He doesn't even realize that he's in the bed to do that. And our dear Claudia Allen says that you have to have a high level of cognition to be able to use a tool, to take the knowledge from your hand through a tool to complete the task. So this was a completely pointless exercise. So, and another thing that hit me when on this thing about doing therapy that is not practical. Some self-care skills are just not worth it. I heard an interview with a young lady who was an artist, and for whatever reason she was now a quadriplegic. She had a little bit of movement in her upper body, and that's it. And she said in an interview that she hated occupational therapy. She said every time they would come in, they'd try to make her feed herself, and she said it was so hard that it just wasn't worth it. She wanted to try and use what little she had to do her art. And it was a sad statement on my profession, because what we were making her do had no meaning for her at all. And at the end of that story, she ended up committing suicide because life was just not worth living. And I'm not going to take it upon the field of OT to think that they could have made her life worth living in any way. But it's a sad feeling to me that OT did not, the wonderful creative profession that we are, did not reach her, and even if to just in some way make her life better. Okay, we worked on stupid things that we think we're supposed to work on that were not of value to her. Okay, so then there's that. All right, now here's a big one, and anybody who knows me, they call me the toiling goddess and all this stuff. It's all about the toilet. Probably one of my worst pet peeves that I see in these facilities all the time is patients in diapers. People who are going home and are supposed to be independent to use the toilet. I'll go see them 2 days before their discharge, and they're wearing a diaper, and they're not being taken to the bathroom regularly. Okay, to me, this is a giant Medicare fraud, for one thing, because we are being paid to prepare them to go home and do these things on their own. So while the therapist might be doing this in the clinic every once in a while, the there's no carryover, so they work on this in the clinic with us, or in the bathroom in the few times that we do ADLs, or even the great therapists who do ADLs every day. And then for the rest of the day, they're left there to pee in their diapers. Okay? And a lot of this happens because facilities do not provide Depends, which then that leads into the whole arena where some families can't afford to provide those kind of underwear, and they're more expensive. So a lot of the places have a rule where unless they're continent, which means they can do it all by themselves, in which case they don't really need therapy, they're not allowed to wear the Depends underwear. They have to wear a brief because it's cheaper. Well, what is the point of all that? Okay, you go and we learn and work with you to get on the toilet, and then the rest of the day and all weekends, you just go in your pants. There's so many things wrong with that I can't even see. That it messes up your bodily mechanisms, for one, your sensation, your knowing when you have to go, you're going on time. It messes all that up. What does that do to your mind, to your dignity, to what you feel about yourself? That even though you could kind of go if you had a little bit of help, that you're just kind of made. I've had patients tell me, oh, well, the CNA told me that if I wear a diaper, I can pee 3 times before she has to come back. No, that's not what this is all about. This system is not supposed to be designed for our convenience. It's supposed to be for them. So then what happens is you have these people who we supposedly met our toileting goals, but they just don't have it because they've been really all the other part of the day going in their pants. Okay, so that whole diaper thing is, I don't know, they're all pretty big pet peeves, but that's a big one. That's a big one. All right, there you have it. A 3-series rundown on Eileen's biggest pet peeves about OT, which I only had pet peeves about OT because I think occupational therapy is one of the most creative, wonderful, life-changing careers that is out there. And done right, we can make life better. All right. Thank you so much for listening.